This is a video of healthy menisci and articular cartilage. In the upper part of the picture is a femoral condyle, and in the lower part of the picture is a tibial plateau. Both surfaces have smooth articular cartilage with no surface cracks or fissures. The meniscus is the cushioning and stabilizing structure that sits between the femur and the tibia. You can see it as a C-shaped cartilage that travels from the front to the back of the knee. There is both a lateral as well as a medial meniscus. Sometimes when a meniscus is torn, it becomes locked and stuck in the front part of the joint. This is a torn lateral meniscus that was locked in the patient's anterior compartment of his knee. The initial approach is to place the meniscus back to its proper anatomic location. Once it is reduced, then the periphery of the meniscus is prepared in such a way as to create a fresh bleeding surface, so that once the meniscus is stitched back to its normal location, it will heal well. A meniscal repair suture is then inserted into the joint. There are two ends of the suture that act as anchors for the knot. Once the two ends are anchored, the sutures are subsequently tightened and the meniscus is reduced into its anatomical location. Usually when the tear is large enough, 2 to 3 repair devices are used. After the sutures are tightened, they are subsequently cut right at the knot. The meniscus is then probed to make sure it is stable and that it is held in such a way that it can heal.